Texas Annual Conference clergy, lay delegates, families, and friends. Hello, I'm Robert Besser. As of January of this year, I was appointed as Director of the Center for Connection and Resources, Conference Treasurer, Benefits Officer for the Texas Annual Conference. Since 1990, these last 33 years, I've been a United Methodist minister of our conference. With me today is Mark Helms, our Controller for the Texas Annual Conference since 2010. Since last summer's 2022 Annual Conference, the Group Health Benefits Committee, in consultation with the Board of Pensions, our health benefits consultant Alera Group, Ryan Johnson and his team, and the TAC benefits staff have completed an extensive analysis of our group health benefits plan for our clergy, our conference lay employees, and their families. The Group Health Benefits Committee has made the following 4 recommendations for change to our group health benefits plan. Each recommendation requires a vote. For full details regarding all recommendations, please refer to the Group Health Benefit Report in your pre-conference journal. The 4 recommendations of change are: first, marriage and family counseling benefit; second, a hearing aid benefit; third, ensuring a sustainable group health plan for the future; and fourth, eligible active group health participant settlement payout in lieu of the TAC retiree medical subsidy. Let's look at each of these recommendations. First, the marriage and family counseling benefit. Beginning in January of 2024, marriage and family counseling will be added as a covered benefit under both the standard PPO and the high deductible medical plans. This provides unlimited marriage and family counseling visits in a calendar year. Second, hearing aid benefit. Beginning January 1st, 2024, hearing aids are being added as a covered benefit under both medical plans for all enrolled participants, including dependents. The third recommendation, ensuring a sustainable group health plan for the future. Beginning January 2024, rate changes are required to ensure a sustainable group health benefit plan for the future. This will align receipts with the true cost of health insurance coverage. Thus, it will eliminate our multi-year operating deficit and our dependence upon declining reserves. The TAC Texas two-step plan includes recommendations that were put on hold due to the COVID-19 pandemic in 2020 and in 2021, and the disaffiliation process in 2022. These recommendations are urgently needed to increase receipts and to decrease expenses. Let's look back on how we got here first before we look at where we are going in the future. The TAC Group Health Benefits Plan has had 4 funding sources: church contributions, participant contributions, investment returns, and apportionment collections. However, you may remember in 2020, we voted to eliminate the 4th funding source, the apportionment for all churches, over a 4-year reduction plan. Therefore, beginning in 2020, these last 4 years, the group health church apportionments have gradually decreased from $2.068 million in 2020 to 0 apportionment dollars beginning in 2024. And because of the reduction in apportionments for the churches who have had a 3/4 or full-time clergy person, their contribution rates have gradually increased to offset the loss of apportionment funding. Therefore, beginning in 2020, these last 4 years, the group health church apportionments have gradually decreased from $2.068 million in 2020 to 0 apportionment dollars beginning in 2024. And because of the reduction in apportionments, for the churches who have a 3/4 or a full-time clergy person, their contribution rates have gradually increased to offset the loss of apportionment funding. Beginning in 2024, apportionments are no longer a funding component of the group health plan. As we have covered in prior sessions of the annual conference, the group health plan has been operating in a deficit position. Historically, plan receipts, the premiums collected from participants and from churches, have trailed the actual expenses. During the 10-year period 2013 to 2020, the planned disbursements, the expenses, exceeded the receipts, the income, by $14.4 million. Investment gains and plan reserves covered this deficit over the last 10 years. Plan year 2022 was the 8th consecutive year where disbursements, where the expenses exceeded the receipts or exceeded the income. Since 2018, the average annual operating deficit has been $2.75 million. Plan reserves reached a peak of $19.8 million in 2017. However, over the next 5 years, 2018 to 2022, the reserve declined by half, thus ending 2022 with a reserve balance of $9.9 million. Disaffiliations in 2022 have resulted in a decline in the number of covered participants as of January 1st, 2023. Plan participation has declined from 524 clergy and lay employees to 317 actives. Now, this does not include covered dependents. The reduction in the plan population will reduce plan receipts and expenses. However, expenses are expected to continue to outpace receipts in 2023 and beyond. And friends, this is unsustainable. In the last few years, in each of the pre-conference journal reports and in each of the presentations before you at annual conference, we have shared that our current model for health insurance for our clergy and their families is not sustainable. We have stated that eventually we will need to look at other options. And we have done that this year. Last year, the Group Health Benefits Committee directed the Center for Connectional Resource Benefit staff, in conjunction with the benefit consultants, the Alira Group, to research and to present proposals for alternatives to the current self-funded active group health benefits plan to the committee for future consideration. Analysis was conducted to determine plan viability under the following design options: to remain self-insured, or to remain self-insured with revised premium rates paid by participants and churches, or to outsource to a fully insured plan model. The committee evaluated various options and plan designs with Westpath's Health Flex fully insured plan and an outsourced model with Blue Cross Blue Shield. Based on careful analysis and study of proposals from third-party insurers, the Group Health Benefits Committee recommends continuing to operate the plan through the existing self-insured model. In all cases, the cost would be much greater under a fully insured arrangement with HealthFlex, Blue Cross Blue Shield, or other plans. Our recommendation number 3, as stated, is to eliminate the health benefits operating deficit, and that is with a 2-step plan: increase receipts, decrease expenses. Step 1 is to align receipts with plan expenses. Clergy and lay employee paid premiums will increase in 2024, and church billing rates will increase in 2025. Historically, we have heavily subsidized our coverage of dependents by charging far less for dependent coverage than the actual cost. Therefore, beginning January 1st, 2024, clergy billing rates will be adjusted so that a greater portion of actual expenses for dependents will be covered. In addition, direct billing rates for laity, early retiree, surviving spouse, dependents of Medicare-eligible participants, and long-term disabled will be adjusted upwards accordingly. Friends, you will recall in 2020 and 2021, proposed increases to align dependent rates with industry norms for dependent coverage were considered, but were delayed due to the impact resulting from the COVID pandemic in both years. Rate increases for dependent coverage were once again examined in 2022, but were delayed due to the uncertainty surrounding the disaffiliation process. Beginning January 1st, 2025, the church billing rate will increase from 12.5% to 14.5%. These rate adjustments are expected to recover the projected operating deficits for both 24 and 25. Going forward, clergy and lay participant paid premiums and church billing rates will be reviewed annually to ensure plan receipts remain on par with plan disbursements. However, with the multi-year decline in our group health benefits reserves, it is no longer feasible for reserves to be a major component of plan funding in future years. Going forward, actual cost must be covered by actual receipts.
Thanks, Robert. This chart reflects the average monthly cost in 2023 for each level of coverage within the standard PPO plan and the high deductible health plan. The costs are calculated based on an average group health benefits compensation of $95,992 per year. Within the top half of the chart are the costs associated with the standard PPO plan, and the bottom half of the chart reflects the costs associated with the high deductible health plan. Look at the fourth column, titled A plus B plus C. In 2023, the monthly cost to cover a family within the standard PPO plan is $2,940 per month. The cost is reflected in the column titled A plus B plus C. The clergy participant pays $740 per month, or roughly 25% of the total cost. The cost to the clergy is reflected in column A. This amount is determined by multiplying the 2023 clergy billing rate of 9.25% by the clergy compensation of $95,992 and dividing by 12. Column B reflects the church contribution towards the cost of the family coverage. Each month, the church pays $895. This amount is determined by the 2023 church billing rate of 11.2% times the clergy compensation of $95,992. In column C, the balance of the cost is funded out by the plan reserves. In the case of the family coverage in 2023, plan reserves are being withdrawn to fund the remainder of the costs, which is $1,305. As you can see, regardless of the level of dependent coverage selected, the plan reserves are being used as a significant funding source in covering the total cost for the various coverage levels. In 2023, dependent coverage is heavily subsidized. In the case of family coverage, the church plus plan reserves cover 75% of the cost. The heavily subsidized costs for dependent coverage in the standard PPO plan have driven the decline in reserves since 2018. During the 5-year period, $10 million of reserves was used to fund their subsidies. We have reached a position where the reduction of plan reserves and positive investment returns can no longer be counted on as a continuous funding component in closing the expense gaps that have become a regular occurrence in this plan. This schedule provides a comparison of the existing monthly premiums paid by clergy based on the billing rates for 2023 and 2024. The premiums are calculated based on average clergy compensation of $95,992. The applicable billing rate is shown for each level of insurance coverage. Within the standard PPO and high deductible plan, there are 4 coverage levels available for a total of 8 options: participant only, participant and spouse, participant and child, and participant and family. As stated, starting in 2024, within the standard PPO plan, the billing rates for all levels of dependent coverage are increasing. The billing rate for participant-only coverage is unchanged. Within the high deductible plan, the billing rates for participant and spouse and family coverage are increasing. However, the increases are not as great percentage-wise as the increases for dependent coverages under the standard PPO plan. Within the high deductible plan, there is no change in the rate for participant and child. The billing rate for participant-only coverage decreases from 3.25% from 4.65% in 2023. As we have discussed, rates for 2024 are designed to more fully align the amount charged for dependent coverage with the actual cost and to encourage participation in the high deductible plan. This chart reflects the average monthly cost in 2024 for each level of coverage within the standard PPO plan and the high deductible health plan. Subsidy levels where the subsidy percent has been decreased are reflected in red. Subsidy levels where the subsidy percentage has been increased are reflected in green. Let's look at the 2024 costs for family coverage in the standard PPO plan. The monthly cost to cover a family within the standard PPO plan is $2,940 and is unchanged from the 2023 example. The cost is reflected in the column titled A plus B plus C equals total cost. The clergy participant cost in 2024 increases to $1,255, or roughly 43% of the total cost. The cost to the clergy is reflected in column A. This amount is determined by multiplying the 2024 clergy billing rate of 15.65% by the average clergy compensation. Column B reflects the church contribution towards the cost of the family coverage. Each month, the church pays $1,000. This amount is determined by multiplying the 2024 church billing rate of 12.5% by the average clergy compensation. Column C reflects the balance of the costs funded out of the plan reserves. Plan reserves are being withdrawn to fund the remainder of the cost, which is $685. The result is a subsidy percentage of 57%, down from the 75% subsidy presently in place in 2023. Next, this chart compares the participant cost for the standard PPO coverage levels in 2023 to the participant costs for the high deductible plan in 2024. As we move into 2024, participants can maintain or reduce their monthly cost by enrolling in the high deductible plan. With the exception being family coverage, the average monthly cost for the high deductible plan in 2024 reflects declines in the cost for coverage levels when compared to the standard PPO plan in 2023. Now let's compare the Texas Annual Conference Group Health Plan to the average for the Texas market for standard PPO plans. The data for the Texas is a cumulative representation of roughly 1,800 Texas-based employers. As you can see, the TAC Group Health Benefit Plan resides on the expensive end of the cost spectrum. Total costs per participant are much higher than the average plan. As mentioned previously, the TAC Group Health Plan dependent coverage has been heavily subsidized relative to the market. These heavy subsidies for dependent coverage have contributed greatly to the funding gaps, which continue to be a challenge for this plan. In the next slide, the decreases in the subsidies stemming from the changes in the billing rates for dependent coverage are reflected for 2024. The clergy billing rates are modified in 2024 to bring the subsidy levels for dependent coverage closer to market norms. The family subsidy is now 57%, down from 75% in 2023. The 57% subsidy is still high compared to the market average. However, a greater portion of the $2,940 in total costs are now borne by the participant that elects family coverage. The subsidy for participant and spouse and participant and child is now 50%, which is close to the market average for the state. Increases in the clergy billing rate, along with increases in the direct billing rates for all other classes of plan participants, is expected to recover roughly $1 million of the forecasted $1.5 million operating deficit. As mentioned earlier, the second component of the committee's intention to increase funding for the plan is to increase the church billing rate to 14.5% in 2025. The increase to 14.5%, up from 12.5% in 2024, will recover the remaining $500,000 of the forecasted operating deficit. The goal by the close of 2025 is to no longer be dependent on the use of plan reserves and investment returns to close the operating deficits that have become common in this plan. As you know, the further we decrease expenses, the less we need to increase receipts. And the flip side of that is also true. The less we decrease expenses means the more we increase receipts. The Group Health Benefits Committee has directed the Center for Connectional Resources, the benefits staff, in conjunction with the Texas Annual Conference Benefit Consultants, Alera Group, to research and present proposals for alternatives to Boone Chapman, the current Group Health Benefit Plan third-party administrator. A change in the TPA is sought to provide a higher level of customer service, claims processing, and administrative efficiencies to active group health plan participants, as well as evaluate other healthcare options with the goal of providing both improved health outcomes for our participants as well as long-term improvement of increasing healthcare cost. Proposals for a new TPA will be considered during the second and third quarters of 2023. If warranted, a new TPA will be announced during the open enrollment period for the 2024 plan year. Any changes in the TPA will be accompanied by investments in healthcare solutions managed within the new TPA contract aimed at utilizing healthcare resources most effectively to enhance member engagement and improve participant health outcomes, thereby reducing claims cost over time. The committee has recently initiated administrative changes to address plan expenses. Recall in 2021, the plan's pharmacy benefits manager was changed to RX benefits express scripts, and modifications were made to the wellness and walking program incentives. The annual savings stemming from these two changes were $600,000 and $200,000 respectively. In the meantime, what are some practical ways to decrease expenses beginning immediately? One, when you have a medical emergency, please go to the nearest emergency room or call 911. If it is not an emergency, please use your primary care provider or a nearby urgent care clinic instead. Another option may be to use Teladoc Benefit, which is available. Emergency rooms are expensive to use. Please use them when medically necessary. Number two, having regular annual checkups with your doctor in the long run, it reduces expenses. It catches problems when they are small before they become big. Number three, if you have a chronic condition such as diabetes, hypertension, or high cholesterol, please take care to do as your doctor has ordered or suggested. And four, there are also situations in which there are gaps in self-care regards to medication management. And five, gaps in participation in disease management programs. Please follow your doctor's recommendations. Now we turn our attention to the retiree medical plan and the final recommendation. Number four, in terms of recommendations, is the active group health participants will receive a settlement payout in lieu of the TAC retiree medical subsidy. The retiree medical plan is expected to remain in a surplus position for the period 2023 to 2025. The surplus of the plan is expected to grow from $7.7 million in 2022 to $9.9 million in 2025. Annual investment returns are expected to provide sufficient resources to meet the annual funding of retiree HRA accounts over the foreseeable future. As of January 1st, 2023, there were 475 Medicare-eligible TAC retirees, spouses of retirees, and surviving spouses receiving the TAC retiree medical subsidy. The Group Health Benefits Committee is recommending a settlement plan whereby active clergy and spouses currently eligible for the TAC retiree medical subsidy would receive a lump sum payment in lieu of receiving the TAC retiree medical subsidy. The settlement payment will be made to eligible individuals as of January 1st, 2024. There are currently 56 active clergy and 38 spouse dependents in the active TAC Group Health Benefits Plan who would be eligible for the TAC retiree medical upon entering retirement. This is the active population that would receive a lump sum payment in lieu of receiving the annual subsidy in retirement. Each eligible individual will receive a payment of $24,000. The lump sum payment will be reduced by service percentages for those whose first appointment was on or after July 1st, 2005. The lump sum payment will be considered taxable income for the 2024 tax year. As a result, the conference will gross up the amount using a rate of 20% to cover the tax incurred on the payment. The retiree medical reserve will be the source of funds used to make payments on January 1st, 2024. All TAC retirees, spouses, and surviving spouses presently receiving the TAC retiree medical subsidy through VIA benefits will continue to receive the retiree medical subsidy and would not be eligible for or affected by the settlement payout to eligible active TAC clergy and spouses. Once the lump sum distributions are made to the eligible actives and eligible spouse dependents, the retiree medical benefit, in other words, the contribution to the HRA account, would be closed to new participants. The benefits of the lump sum payout to eligible recipients are as follows. First, the cash payment is not limited to reimbursement of healthcare expenses. The recipient will have the flexibility to utilize the funds as desired. Two, the cash payment is available for immediate investment and future returns. And three, the taxes associated with distribution are mitigated by the 20% gross up applied towards the payment. The conference benefits from this program as it shortens the duration of the existing accrued liability. Shortening the duration of the liability assists the conference in its efforts to manage reserves in an environment where resources have been reduced and are expected to be limited in the near term.
So friends, to summarize, the Group Health Benefits Committee has 4 recommendations for change beginning in 2024. The 4 recommendations for vote are adding marriage and family counseling as a covered benefit under both medical plans. Add hearing aids as a covered benefit under both medical plans. Third, the elimination of our dependence upon our plan reserves by aligning receipts with the true cost of health insurance coverage. Again, this is achieved through the Texas two-step plan of increased receipts by increasing participant-paid premiums and also by decreasing plan expenses through the initiation of healthcare initiatives. And then fourth recommendation is a lump sum payment made to active clergy and spouses currently eligible for the TAC retiree medical subsidy. The payment will be made in lieu of receiving the retiree medical subsidy at retirement. This settlement will shorten the duration of the retiree medical liability, which was $14.1 million as of January 1st, 2023, measurements by date. The one-time payment made to 94 eligible individuals will settle between $2 and $2.5 million of the plan obligation. Friends, this concludes our report. The next time you see one of our Group Health Benefits Committee members, please express your appreciation to them. With the pandemic, the disaffiliations, the federal and state government regulations concerning health care, and the continuing increases in cost, there are many variables to manage and to stay on top of. This is a working committee with excellent input and support from the TAC benefits staff. They have done a stellar job, and we appreciate them so very much.